all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Good evening everyone. I am Jessila Mujib welcoming you to a brand new episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. Good health begins with mouth. Poor oral hygiene may lead to many complications related to health. I am sure most of our viewers would have a lot of doubts regarding good oral hygiene or oral health. To clarify all the doubts, we have with us Dr. Suhana Naaz from Al Hilal Hospital, Hamad town. She is a specialist in conservative dentistry and endodontics, and she comes with an experience of more than 15 years in dentistry. So let's welcome doctor to the show and move on to the topic. So doctor, welcome to the show and thank you for joining us today.
Thank you so much for the warm welcome you've given, Jessila. That's very nice of you.
It's a pleasure for us. So doctor, today our topic is oral hygiene.
Yes.
And we would like to know about the importance of oral hygiene.
Generally people ignore the fact of oral health, saying that it's just a tooth, why do we need to take care so much about just a tooth? But I think the first thing when you look at a person is a smile. So I think maintaining the oral health gives you a beautiful smile, and a beautiful smile comes only when you're confident about your teeth, how they look. Secondly, I mean, you need your teeth to eat a balanced diet. When you don't have teeth, you can't eat on whatever healthy, especially the fibrous foods, which are really healthy for our body. So maintaining oral health is really important. And third of all, most of the oral infections might lead to systemic infections also. Like if there is any decay, it might spread and cause problems in your systemic health also.
Okay. So doctor, what is the connection between oral health and overall health?
Like I already mentioned, oral health is very important when you're considering your systemic health, because first of all, our the oral cavity, it has the maximum number of microorganisms within, but these microorganisms are in a balanced harmony with our oral environment. Unless there is any disturbance in the oral cavity, that's when they cause any infection. So in case you don't maintain a good oral hygiene, to infections, it will lead to systemic complication, because oral cavity, from there you have the digestive tract and respiratory tract going. So it might cause your respiratory infection as well as digestive infections. And secondly, I mean, if there is any systemic diseases, let it be like oral cancers or any other cancer, first of the beginning manifestations will be in the oral cavity. You can see like some lesions, or there can be ulcers or white lines, patches, or decrease in salivary flow. Then it is an alarm. I mean, once you visit a dentist, they will give you importance, like you are supposed to go and meet a doctor. So unless you take care of it, you will not be aware of the upcoming more problematic situation. Secondly, and there are other conditions like commonly now, which is the most common, is diabetes. Even in diabetes, most of the people, they have issues with their gums, because the salivary flow will be slightly reduced in diabetic people, and the gum issues also, the mobility, everything is more compared. So if you keep regularly visiting the dentist and maintaining your oral hygiene, it will cause you less of systemic problems.
Doctor, how can we maintain a proper oral hygiene? Please give us a few helpful tips.
The simplest thing is to brush your teeth, which some of the people don't even think is a requirement to do. So generally it is better to brush twice daily, if not at least once a day. I mean, in a proper method of brushing. Some patients come and tell, no doctor, I brush half an hour. It's not about half an hour or 1 hour of brushing. It's basically method of brushing what you do. And secondly, I mean, you can use floss. If there is interdental spaces, there would be food lodgement. So it is always better you floss your teeth, especially those who have spacing. So I mean, so that there's no food lodgement in between the teeth. Then you have, I mean, after every meal, it's a good practice to gargle your mouth. If you don't find a place, in a place where you can't go for gargling, I don't think there's anything like that, but still, in case you don't want to go for gargling, at least drink a slight amount of water, so that there's no sticky food, in the mouth. Then I would say go for more fibrous and a balanced diet rather than sugary and sweet intake, because then again some parents come and tell, no, children don't eat that much of sweets, just that the number of times they eat is more, but they eat in small quantities. Again, it's not the amount of sugar intake, it's the amount of frequency in what they eat. It's always reduce this frequency. I'm not saying completely stop, don't give children sweet, but make a habit, like there is a table on, like, okay, once daily or maximum twice daily you can have a chocolate, and don't give candy, because those are more of sticky food, sticky and when you bite on it, there can be a fracture of tooth. It's always better to give hard, not candy type, or softer and not sticky type of food. And you can use chewing gums in between, which are not sugary chewing gum, and reduce the intake of aerated drinks. And especially, I would say, don't take aerated drinks, but in case you're taking aerated drinks, I mean, out of you have an urge to take, don't immediately brush your teeth, because aerated drinks, they cause softening of the outer layer of tooth, which is the enamel. So it's always after you have an aerated drink, just gargle your mouth, so that it doesn't cause softening of your enamel tissues.
So it's not advisable to brush the teeth after aerated?
No, yeah, immediately, because at that moment, because of the aerated and the acidic acidic content, it might cause softening of the teeth, and immediately you brush, it wears off. So that's why it might cause sensitivity problems. So that is one more advice I would say.
So, doctor, now you mentioned about the proper method of brushing. Can you explain for us the proper method of brushing?
The proper method of brushing is you have to place the brush at an angle of 45°, and if it is the upper tooth, move your brush from up to downward direction, whereas for the down teeth you have to go from down to up direction. And always, it's not just brushing the outer surface of your teeth, you have to particularly brush the inner surfaces also from inside. Generally, most of the patient, when they come, outside will be very good. I mean, most of the patients, they maintain well outside, but when it comes to inside, especially the lower teeth, you generally see a lot of calculus and food deposits. So, and then you have to brush the upper surfaces, the chewing surfaces also. So once you brush your teeth, you just take a look in the mirror and see, I mean, whether you're satisfied, because if you're satisfied, anyways, you have maintained that oral hygiene. And brushing doesn't need to be like for half an hour or 1 hour, it's just 2 minutes of brushing also, but brushing all the surfaces well.
So, doctor, what type of brush should we use to brush the teeth? And how often should we replace the brush?
Okay, the brush, what we generally recommended are with the soft bristles, so that the hard bristles generally they abrade the teeth. Some of the patients, I mean, medium bristles are also okay, but the soft bristles are always gentle. With proper method of brushing, the soft bristles will do the job. And about the replacing of the toothbrush, it is always recommended to replace it 3 to 4 months after use. But if you feel the brush is worn out, don't wait for that 4 months period, replace it immediately. And it's basically the method of brushing and how you brush it which matters, and that's how the duration of your brush also will last.
Now we know that there is an electronic brush and also manual brush. So what's the difference between that?
Yeah, coming to electronic and manual brush, the electronic brushes are more, we recommend it for patients who are compromised, like, you know, who have specially abled patients. And secondly, for kids who are not able to brush well to all the surfaces. What happens in electronic brushes, they do the job, even the kids enjoy brushing with that because of the sound and, you know, how it goes. So, and it goes to all the surfaces and brushes well. Whereas manual brushing, it is always, it's been with ages, it's always good, no issues with that. But unless it is, you know, in some patients, especially kids and like I mentioned, compromised patients, that's when you can recommend them with these electronic brushes. The only thing is the charges will be more and, you know, battery operated, more, you have to be careful while handling them, that's all. Otherwise, it's good enough.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
A common query from our viewers is, around what age the child should start brushing his or her teeth?
The care of oral hygiene should be taken from birth itself. As soon as the child is born, while you're breastfeeding, just make sure you just run the gum pads with little water, so that you know the milk has sugar content. It doesn't cause any early caries during teething, because generally kids will start getting early nursing bottle caries. That is like as soon as the teeth erupt itself, there would be caries. So that to prevent that, you need to be careful from the beginning itself. And as soon as the new teeth erupt, it's always better, you know, you run with a brush with your fingertips at least, you know. And then around the age of 6 months to 2 years, you can use toothbrushes, and you need to guide them how to gargle their mouth, and with a small size of like pea size, you can ask them to brush their teeth. And parental care is a must when it's concerned with the primary teeth, because parents think it's just a primary teeth and it will shed off, we don't need to take care. Only if your primary teeth are in good condition is when the permanent teeth are going to come in proper place, and you know they are going to be in good health. And even for a child's diet also, if the teeth is not good, he is not going to be able to eat healthy food, fibrous food. So always maintain good oral hygiene in kids.
Okay. Doctor, would you suggest any specific toothpaste for us?
I wouldn't say any specific toothpaste, because most of the toothpastes are under ADA specification, recommended what the ADA is nothing but American Dental Association recommendation. So generally it's again I will mention it's the method of brushing more than the toothpaste. Only in some cases we recommended toothpaste different, like when the teeth are sensitive, that's when we recommend toothpaste which have more of fluoride content, like stannous fluoride and potassium nitrate. In patients who have gum problem, that's when we recommend a different type of toothpaste. But otherwise, normally any toothpaste with any brand is okay.
Doctor, another common query is how often should a person visit the dentist?
Definitely 6 months, because only then you will be able to maintain good oral hygiene. Maybe there is a procedure or not, but a visit to a dentist is a must, so that you know you don't have to go and undergo all the hassles after decay has progressed to later stages. At the beginning, prevention is better than cures. That's what the saying is. So it's always better to prevent it rather than, you know, undergo the treatment.
Now, can you explain the importance of oral hygiene during pregnancy?
Yeah, during pregnancy, oral hygiene is a must, because what happens in pregnant females, they have this gag sensation, because of which they are unable to brush. They don't like brushing early in the morning because of that nauseating feeling, yes. And you know they have that vomiting. So that's when you know they neglect their oral hygiene at that moment, and because of the vomiting, the acidic content in the vomit, it will cause problems in the teeth. So always it's better to maintain a oral hygiene by visiting a dentist, because later on during pregnancy, if you don't take care, what happens is it will affect the general health of the pregnant female, because she is unable to eat balanced food, which is not good for the nutrition of her health as well as the child's. And secondly, it is if there is any complication in the teeth, the thing is she won't be able to undergo treatment during the first trimester or the third trimester. It's only during the second trimester, like extraction of the teeth. Rest of the treatments can be done, but especially the extraction of the teeth can only be done during that second trimester. Till then, the patient has to undergo all the pain and you know suffering which he has to go through. So it's always better, you know, to take care. And any if the oral health is not maintained, what happens is the infection can spread and cause some systemic complications also, and some of the antibiotics are not recommended during pregnancy. So it's always better, you know, to maintain good oral hygiene, especially during pregnancy. To just add a note on that, even in immunocompromised patients, I would say, like patients suffering from cancer or any other diseases where they are not able to maintain good oral hygiene, or when some medications there will be salivary content, decrease in salivary flow because of the medication. In such cases, the oral hygiene should be maintained well, and some of the sialagogue medications, like, you know, to increase the salivary flow, the dentist would recommend. So it's better, you know, to take a oral checkup and maintain an oral hygiene.
Now, before we wrap up, what is your takeaway message for our viewers?
My takeaway message would be, please visit a dentist, brush your teeth every day, maintain good oral hygiene, eat balanced diet, and take care from the beginning itself, prevention rather than cure.
Thank you, doctor. Thank you for joining us and giving us a lot of valuable information about oral hygiene. We appreciate your presence here. Thank you once again.
Thank you so much. It was nice being here. Thank you so much.
So, viewers, I am sure this was a very informative episode. A smile is the most inexpensive and the best accessory you can wear. So, take care of your teeth, do pay visit to the dentist regularly, and take care of your overall health. Till we meet again, this is Jessila Mujib signing off. Good night.